such an insightful, engaging, mind-blowing session. We've had quite a number of initiatives, a number of declarations that have been previously mentioned. And now this session will really put young women, older women, women of all color to the center, and also focus on youth and how health and climate change impacts on them. My name is Lizz Ntonjira. I'm a youth champion and the Global Communications Director at Amref Health Africa. And with me, I have such an amazing panel that consists of, please do come to the stage when I call your name, Dr. Jenny Miller, the Executive Director, Global Climate Change and Health Alliance. We have Lucinda O'Hanlon, Head of Policy and Strategy at Sanitation and Water for All. And we do have a virtual panelist, Dr. Edward Mungai, who's the consulting partner at the Kenya Climate Change Innovation Center. And we do have an exciting and very engaging panel, audience, virtually. Over 200 people are joining us. So thank you so much for joining us. Jenny, let me start with you. Tell us about your experience in bringing together and coalescing civil societies to address such barriers and any other barriers that we've not seen in that really touching video.
Yeah, thank you. So a little bit about the Global Climate and Health Alliance. It was founded about 10 years ago in order to bring a strong health voice to the climate conversation. And it came from health organizations that were starting to become concerned about climate change, but didn't see the impacts on people being articulated in the climate discussions and being addressed in the climate discussions. So the Climate and Health Alliance is made up of health organizations from around the world that work together on this issue. You started out by mentioning youth and women and the particular impacts there. From the get-go, we recognized that it was really important to have youth representation at the table, to have women's leadership, to have health equity, gender equity, and these kinds of things at the center of bringing this issue to the international community. So from the very beginning, medical students have been on the board of directors of the Climate and Health Alliance. We also, I guess it's 3 years ago now, joined with the World Health Organization to, we were invited to form the WHO Civil Society Working Group on Climate Change and Health to really strengthen the collaboration with WHO, between WHO and civil society, again, to bring a stronger voice on this issue to the global stage. And I think we've really seen some of the power of that collaboration. Just last year, we together spearheaded a letter from the health community to national leaders that were going to the COP negotiations and to the negotiators that called for action in climate change to protect health, to address the impacts on health, also to ensure that the solutions really protected health as much as possible. And that letter got sign on from over 600 organizations around the world, health organizations around the world, representing 46 million health professionals. So that's around 2/3 of the health professionals of the world. Some of the barriers that I see, I think Maria Nera mentioned a couple of them, the two things that I would highlight as well. One of those is, health professionals and health workers and the organizations that are from the health sector have many, many competing demands on their attention and on their time. I think the thing that has changed in just the last few years is that as the health community, we're now realizing we must step up. The impacts of climate change are so significant, and they're going to touch every other aspect of the work that we do, that we have to bring the health voice to the table to make a difference. And then the other barrier that I would note is that at those climate decision-making tables and the multi-sectoral, the other sectors where key policies are decided on that have an impact on climate change and health, health is frequently not at the table. We often don't see health leadership there. So that's why kind of collaboration, partnerships such as the one that is being founded and launched, civil society collaboration, I think that's so critical in order to bring a more powerful voice and really come together with a voice on this issue.
You've mentioned quite amazing things, but two things stood out for me. One is the fact that there are young medical doctors in your board, which I encourage you all to have, young representation within your boards and senior management in your organizations, because then it's very inclusive and everybody has a seat at the table. The other thing you've mentioned is on the competing priorities. And it's quite unfortunate that early this year, I think in February in Malawi, the first case of polio was registered after 5 years of it being declared controlled. How then, Lucinda, I'm coming to you, based on this, we're really dealing with sort of like a triple crisis. We have health, economy, and climate, and we've seen it play out very well and contextualized in that video, and also what Dr. Maria's panel did mention, including the minister's speech. How then can we coalesce different organizations? How can the global community come together to address these challenges?
Thanks so much for the question. Good evening, everyone. So just to start by describing a bit about Sanitation and Water for All, we're a UN-hosted global partnership that works to elevate the prioritization of water and sanitation in national and global agendas through multi-stakeholder action and system strengthening. And we know, I think we've heard it from the other panelists that water and sanitation are prerequisites for good public health. And the COVID pandemic was a good reminder of this. As Maria said, we're being told to wash our hands, but where? I think we need to remember that still 1 in 4 people doesn't have access to clean water. Over half the world's population doesn't have access to a toilet. And during the pandemic, 3/4 of the population of the least developed countries did not have access to basic hand washing facilities. So these are really jarring numbers to think about. And climate change, of course, is making it all worse. With climate events, we are faced with situations where we have more water, too much water, or too little water. And that has ripple effects across all dimensions of our lives. What we're trying to do through our partnership is to work across sectors. And just last week, in fact, I'm fresh off the plane this weekend, we had a ministerial level meeting in Jakarta. We had over 350 participants, over 50 ministers from 57 countries. And for the first time in our high-level meeting, we didn't only invite the ministers of water and sanitation. We invited the ministers of health, of environment, of economy, and they came. We had delegations, sometimes of 3 or 4 ministers, all from the same country, for the first time sitting together in a global meeting. And they were able to exchange on the strategies that they're adopting, on the challenges that they face, speaking directly to each other in order to come up with sustainable solutions. In the discussions, it was recognized that water and sanitation are indispensable for prevention of future pandemics and public health emergencies, that it's integral to support economic development, not only by keeping people healthy, but through creating jobs and supporting innovation, and that it's imperative for communities to be resilient to the impacts of climate change. Throughout those discussions, there was also a strong focus on inequalities, recognizing that those who are already suffering discrimination in so many different ways, the pandemic, climate change exacerbates all of that. We saw with women during the pandemic that that women shouldered the burden of care, either as frontline health workers, the majority of frontline health workers are women, or as caregivers at home. The video very powerfully showed the impact of climate change and water becoming scarcer, and women having to travel even further distances or having to use dirty water to serve their families and risking making their family members sick. I'm talking about a meeting, but it's more than a meeting. It's a process. And the preparatory process to arrive at this meeting created an opportunity for our partners at country level to come together, to establish inclusive and participatory platforms, and to sit together and think what's working well, what's not working well, and how do we come together to address that. And partners came to the meeting with then concrete commitments, intersectoral commitments. The commitments, for instance, related to building capacity of the authorities to work at the intersection of climate, health, and water and sanitation. There were commitments to integrate water and sanitation into climate adaptation plans, national adaptation plans, to increase the number of health facilities that have sustainable access to water and sanitation. So those are the types of things that countries were coming up with. Youth were also actively engaged in the preparations for the meeting. They got together ahead of time and developed key messages to bring to the ministers at the meeting. At our closing ceremony, a 9-point action plan was presented to the ministers by our youth representatives, which really emphasized their priorities, that we need to work hand in hand with them as agents of change, that we have to have a priority focus on addressing inequalities, on understanding water and sanitation as a matter of social justice, and the need to seek transformative solutions. I'm going to wrap up, but I don't want to finish without saying what are some of our key takeaways were from the meeting, which were in the outcome document that was shared. So first, there was agreement that we need to implement reforms to ensure stronger enabling environments. What does that mean? It means reforms that would facilitate greater intersectoral action, that would ensure good governance is in place so that as we seek to build stronger water and sanitation systems, that they flourish and don't collapse because they're not maintained properly. There was agreement that we have to insist on accountability as a central tenet for accelerating progress. We see accountability not as a naming and shaming function, but as a way to ensure multi-stakeholder action, as a way to convene people to have honest reflections on what's working well and what's not, and to take corrective action. And then finally, and the Honorable Minister said it very well, and in the previous panel, we need political will. And that, we think, is the magic ingredient for progress. When we understand water and sanitation as matters of social justice, we create the urgency that's needed for that accelerated action. So we're looking forward to taking forward these messages to COP27 in Sharm el-Sheikh, to other global processes, but our partners are also taking this forward at national level to deepen those intersectoral linkages in order to make better progress. We only have 8 years left until we're supposed to deliver on the SDGs. So we have to do better and do more together.
And we need to walk the talk.
Absolutely.
Absolutely. Thank you so much. Thanks. Those are really key, important takeaways. And I really like the aspect of looking at the vulnerable communities, youth and women as agents of change. And I really like that you brought into discussion or into play the role of innovation. And, you know, the private sector thrives a lot on innovation. And that brings me to my next question to Dr. Mungai, who's joining us virtually. So the question I have for you, Dr. Mungai, is what does meaningful youth and women engagement look like? And what are some of the things that the private sector can undertake to ensure that everybody is on the table when we're talking about health and climate change? Over to you, Dr. Mungai.
Thanks, Liz, and I hope you can be able to hear me clearly.
Yes, we can.
All right, thank you for having me, and good evening from Nairobi. And, it's a fantastic question that you put there is, but I would, as Minister was saying there, that there is always two parts of a story. So the first one is obviously looking at climate change as a threat. We are oftentimes told that in 21st century, this is the biggest disaster which is facing humankind. On the other hand, it could also be an opportunity. And I'm here to represent, that view that it could also be an opportunity for our young people and for our women. And, to just give a little bit of context into this conversation, I'm coming from a situation where 12 years ago, I had a real challenge with my mother, who is partially blind, out of cooking in a dirty kitchen, smoke-filled kitchen, which then I was trying to figure out for a solution, and something which, was about a health problem turned out to become, a climate change solution. And how did we go about that? It's just by including the young people of Kenya and the women of Kenya to provide their own solutions to the menace of climate change. Fortunately, the World Bank was there, gave us $4.5 million in 2012 to figure out how can we, in an innovative way, support the young people of Kenya to come with market-based innovations around climate change and hopefully solving some of the challenges that we are seeing on that video. Now, fast forward 10 years later, we have, close to $70 million US, which is going to support the young people and again, the women of Kenya, meaning that there must be something that, that is happening, and they are coming up with solutions that are helping us, to address that nexus between climate change and health. And what is this? Well, of course, it needs to be development unusual. I think if we treat development normally, it will treat us abnormally, I should say that. And what does that exactly mean? Is that we must be oriented towards innovations. And as we talk about solutions that you're providing, it doesn't need to be plain vanilla solutions. It needs to be innovative solutions from the technologies that you're using and even the delivery, that and how products are provided into the market. And young people of Kenya are eager, and as is the Silicon Savannah where everybody wants to come up with new innovations that can be put into the market. The question is, what mechanisms do we have to support those solutions? Because clearly, I can tell you there are a lot of solutions. The problem is we do not apply ourselves, and I think that's why the question is coming about, what is it that we can be able to do to enable more young people of Kenya to be able to get into that space where they can be able to come up with solutions. And not only in Kenya, now we have established, a brand new institution. Kenya, KCIC was looking at Kenya. KCIC Consulting now is going Pan-African and trying to come up with solutions together with AMLEF that will be able to address this gap. Of course, it's also about looking at financing. It's not about, again, plain vanilla financing. We must look at innovative financing mechanism, which can take kids and young people and women who have an idea. We provide them with proof of concept, take them to seed funding, take them to impact funding, and then scale them and go to corporate funding. And that's how we are going to replicate, the various solutions. Of course, the enabling environment, and I must say, government of Kenya have been very progressive. As an example, providing that enabling environment that enables young people and the youth to come up with innovative solutions, which they can be able to put in the market. Because we all know that innovation is always ahead of policy, and you can have a brilliant product, but unfortunately, you cannot put it in the market, yet the government is listening. And once they listen, they can't be able to allow such products to be able to be, mainstreamed into the market. And this is what we need to see. This is what we need to see in more markets and more countries where that goodwill that is being talked about in the panel is required from the government. Of course, it's also about, thinking about the way, funding agencies and people with money are thinking about providing that money. And I must say, it must qualify to two things. One, it must be commercial orientation, meaning it's self-sustaining, because it's not about giving grants. The idea is that, can we come up with solutions that we provide to the young people and the women such that at the back of our minds, we have that commercial discipline. With commercial discipline, it is going to resolve, the challenge of just giving a donation and it becomes sustainable. A good example, we were seeing water there and water becoming a challenge. Is it possible to enable new solutions and new technologies which are coming as a result of water, not to give it as a grant, or rather not to give it as a donation, but to have a commercial discipline and help build a private sector or market-based, solution that then would be able to deliver that solution to the people of Africa and help therefore solving the problem. Of course, the other element that is very important is the services that we need to provide to these young people. Remember, they are not necessarily business people. And this is a mistake that we make all the time. Thinking that they are business people, we must be able to walk the journey with them, roll our sleeves, hold them their hand, walk with them, teach them what is to make a bankable business plan, how to make a financial model, who to go for, for financing and what kind of financing. And before we know it, we'll start seeing solutions that will truly address some of the challenges, that are being highlighted. Of course, it's also about, the people with the money understanding the local circumstances, and localizing the solutions, because we cannot expect, a solution which is working in the southern part of Africa to work on the northern part of Africa. It must be customized. And again, this is the platform where this can be done. And truly, I've seen already, conversations between ourselves, KCIC Consulting, AMREF, and probably others who are going to join us as we work towards, the nexus between climate change and health, and of course, government of Kenya, not leaving government of Kenya behind, so that then we can be able to prove that truly there are solutions that can be put in place and we can solve the problems ourselves, provided we are enabled. And therefore, the most vulnerable, the youth and the women of Africa, then can have their own solutions, not only to solve climate change, but also to put a little bit of disposable income into their pocket. And therefore, it becomes, a win-win solutions for all. Thank you.
Oh, wow. Thank you so much, Dr. Mungai, for those really enriching insights. I think a lot of great things have been mentioned by our superb panelists. But what I can mention is that it's all about innovation, implementation, taking corrective action, and all this is brought together by ensuring that we are collaborating together, whether it's the public sector, private sector, and the international development sector. I can see there's so many comments online. It's a really engaging session. Unfortunately, we are time bound. We're limited in terms of time, but thank you so much for those amazing insights. Really appreciate it. And this is a conversation that keeps on going. And we will see what comes up next. So it's not policy documents that just sit on tables, but it's something that we're implementing. Thank you so much for listening.